Hi, it's Dr. Meyer in San Francisco, and I want to introduce you to one of my patients, Amy, who was just telling me about some really good results that she had, and I asked her if she wouldn't mind sharing that on a video. So I'll get this going by just saying, how long have you known our clinic?
Oh, probably 3 years. You came to a health fair at my company.
Okay, and what was the reason that you first came into our office?
To see you with just an evaluation.
Okay.
And I was having pain in my hands and in my neck, and you took some x-rays and you said that it was probably the pain in my hands was caused by a pain in my neck.
Okay, and that was recently, that was maybe 4 or 5 months ago?
Yes.
Okay. Prior to that, you had been coming into our office, I think, like once a year or something for a massage, right?
Yes.
Okay. And how were you feeling during those couple of years? Were you having symptoms or just stress?
Just stress, I think, and some symptoms, but not on a regular basis.
When did these things with your arm and hands and neck start?
Probably about a year and a half ago.
Okay.
And it took me that long to come in.
Okay, but in all fairness, you weren't sitting around doing absolutely nothing.
No.
You went to Kaiser, you reported it, and said, you know, I have some kind of occupational.
Yes.
And what they did, what did they do?
They gave me some physical therapy, did an ergonomic evaluation, but still the pain persisted, and a lot of times it even got worse after that. I couldn't bend my hands, couldn't bend my fingers. In the morning, I couldn't make my bed. It was so painful. Right.
So when we say that our condition interferes with our activities of daily living, that's our quality of life, right?
Yes, it is.
Okay, so then you decided to come in here and we did that assessment, we took x-rays and we saw that there were some problems in the neck.
Yes.
Right? That really hadn't been identified yet, right?
Correct.
And so we talked about how that was affecting the nerves that travel down the arms?
Yes.
Okay, so we came up with a plan, how we're going to provide care. And we started off, and then you've even had some issues come up in the middle where you had to go out of town,
Yes.
things happened.
Yes.
And even with that, without sticking to the whole plan, you told me that you've gotten
a lot better. I can bend my fingers in the morning, my hands don't ache. I still have another issue with my finger, but I think even that's gotten better. And so I'm just totally very happy. I thought I was going to be this way for the rest of my life, and now I realize it was just a problem with my neck and needing adjustments, needing some care.
So a little while ago you said to me that you were afraid that you wouldn't even be able to use your hands at some point.
Yes.
That's awful.
I thought that pain was always going to be there with me and would never go away, and that maybe I should just resign myself to getting used to it.
Okay.
And I'm so happy I don't have to do that.
Yeah. So we also did, I just want to make sure that, you know, for anybody who watches this, we did identify that you probably do have a localized problem with the arms and the hands as well. So
Yes.
in terms of overuse. So we've been working with them too.
Yes.
But yeah, if we weren't able to identify what condition the neck was in,
Yes.
we'd be missing so much information, and that's probably a lot of why past treatment, whether with Kaiser or anything else that was tried, wouldn't have really done the trick.
Yes.
So terrific. Well, I want to say thank you very much for taking your time for doing this video for us,
Sure.
and it's great to have you as a patient, and we appreciate that.
Thank you.
All right, thank you too.